we have been focusing really since 2018 on a national PrEP program for un and underinsured populations. But actually, such a program would also have benefits even for insured populations, because what we have wanted to do is pull together sort of a coordinated, simultaneous program that addresses the major barriers to PrEP access that we hear about repeatedly from community members. One being the complexity of cost and coverage. So we really would love to see some kind of federal mechanism. We call it a PrEP pass, where people could intuitively and easily access that. And that unlocks their door to not just the medication, but the associated labs, provider visits, all very simple, very easy, and where it meets people where they're at. The second piece being we need greater network expansion. Right now, a lot of the model still remains sort of if you build it, they will come. But the problem is that's not true, especially when you're talking about preventive. And we learned about this in COVID for sure. You need to get it ridiculously easy for people to access right where they are. So we would like to see a hub and spokes model where you can take some of those centers of excellence for HIV and PrEP care that already exist in communities and link them, particularly through leveraging telehealth, to other brick and mortar spots in people's communities, connecting that, opening the door through access through pharmacies, or just direct telehealth sort of outreach to communities to give people as many options as possible to access PrEP in their communities. And then the final pillar would be just better campaigns that are buy-in for the communities that we're trying to access. Too often, the same campaigns target the same communities. I have a great colleague, Kenyon Farrow, who's just always so frustrated because great sources of information for Black communities, for Latinx communities, they get left out of the mix. And part of that's because we need a better approach to those sorts of campaigns. So that's what we've been calling for, and actually did see the Biden administration call for such a program 3 years in a row in their budget request to Congress. These days, we're seeing where we are with our champions in Washington. The National PrEP program was never fully funded. It was in the request. We've not seen that request continue with the Trump administration. However, we were successful in getting the CDC, the Division of HIV Prevention there, to commit to 5 pilot sites, South Carolina, Oklahoma, Florida, Houston, and Baltimore, to basically test out this sort of theory of access. And as of right now, that's still continuing. So we are in contact with those jurisdictions and seeing what we can do to help support it, keep an eye on all of that. Notably, this was the first time ever that CDC funds were allowed to go directly toward paying for antiretrovirals of any kind. And that was a hat tip to the fact that, one, the advocates pressed for it, but two, that we have cheap generics. And so you could actually come up with some different options to maybe facilitate the cost and coverage issues for patients. So, we're still seeing where that's headed. But of course, the big challenge we're seeing right now is that the Trump administration and its budget request to Congress for FY26 appropriations has all but eliminated the Division of HIV Prevention at CDC, while they have maintained in their proposal some funding for the Ending the HIV Epidemic Initiative, which was actually started by President Trump in 2019 during his first administration. It doesn't make sense to do that because it's sort of like, let's take out the foundation and then leave the roof of the house. It doesn't make any logical sense. You're not going to be able to build any sort of an ending the epidemic response if you don't have basic surveillance testing, not to mention all of the essential PrEP services that you see there.